Good afternoon, everyone. Y'all gonna make me do that again. Good afternoon, everyone.
Good afternoon.
Mr. Davis, not necessary, but I appreciate it also, ma'am. I hope everyone is enjoying this great fall weather. It is customary for the Board of Commissioners in Nash County to begin each of our meetings with a prayer, and during this time, you're welcome to stand and join us in the prayer that we have. You're welcome to use this time for your own prayer if you like, or you're welcome to use it for a moment of silence. And at this time, I'd like to call on Dan Cone to do the invocation, and then Wayne Outlaw to do the Pledge of Allegiance of a flag. Dan?
You please stand. And before I pray, I'd like to recognize Miss Lou Richardson. Today is her birthday. So I think we.
Happy birthday to you. Happy birthday to you.
Happy birthday, dear Lou.
Happy
Birthday to you. Now we're all in trouble.
She said, don't do that.
Thank you so much.
But anyway, let us pray. Dear Heavenly Father, we thank you for another beautiful day, Lord. We thank you for life and health and everything that you provide for us, Lord. Forgive us when we take you so much for granted. Lord, today we thank you for Miss Lou and her life and what she's meant to this board, what she's done for Nash County, Lord. And we just are proud that we can recognize her today. Lord, we just pray that everything we do and say here today is for the betterment of Nash County, and everything we do would be pleasing to your sight. In your name we pray. Amen.
Amen.
Would you join us in the pledge? I pledge allegiance to the flag of the United States of America
And to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We're now on item number 4, if you're following us on the agenda. And each month that we have a second meeting, we try to do an outside presenter and then someone in-house to present. And our Vice Chair, Commissioner Outlaw, generally handles and puts those together with the Assistant City Manager, County Manager, excuse me. And so at this time, I'd call on Commissioner Outlaw to present the 2 speakers that we have here today. Commissioner?
Thank you, Mr. Chairman. I appreciate that very much. Today, for our outside presentation, we have Dion Viventi, who's the director of the Rocky Mount Wilson Regional Airport. Mr. Viventi and possibly some of those accompanying him will make comments to give us a status report on the airport. Mr. Viventi is accompanied today by Gary Hodges, Chairman of the Aviation Authority Board, and Mr. Charles Mullen, board member representing Nash County. We're honored to have you guys with us today, and now I'll turn it over to Mr. Viventi.
Good afternoon.
Members of the board, thank you, Mr. Outlaw, for that fine introduction. Good to see you, Mr. Manager.
Good to see you.
I am delighted to be here today to give you an update on the current state affairs at the airport. There's been a lot going on out there, and this is actually a good opportunity to take a pause and refresh you all on what's going on out there, what's new, what's been going in, and what's next. So I prepared a new PowerPoint presentation from scratch with some great pictures that Mr. Hodges and I took recently. So everything on here is new. Nothing is older than I don't know, 6 months. But with that in mind, I'd like to start, if it's okay. I think I've got the mouse here, so I've got control of this thing. This is great. My goodness.
You're in total control, sir.
Okay, there we go. What's new at the airport? Well, there's a lot going on out there. I put this little picture together to show you from the sky what's been happening, and there's a long list, but multiple planning, design, and capital improvements projects totaling more than $20 million. In the last few years, federal and local funding has been implemented over the past few years, including state money as well. Of course, The airport hadn't gotten a whole lot of attention for a few decades, so we're playing catch-up, but we're doing good, and we're being good stewards of the taxpayers' money. And I'd like to go over each project one by one, just briefly. Let's see here. There we go. I'm sorry. First and foremost is our new 23-unit T-hangar facility. It just went up. We've got the COs for all 3 buildings. It's well lit, it's beautiful, it's pilot friendly, and it's currently 100% occupied. We had no problem leasing out every single one of these T-hangars. I call these T-hangars the Taj Mahal T-hangars for good reason. They're just beautiful. And, you know, we had a pent-up demand for based aircraft, and this fulfilled that demand. And we're already working on our new waiting list for the next batch if we get the opportunity again to do so.
You said you're already 100% occupied?
Yes, sir.
Really?
Actually, we're almost 100% occupied before we issued the COs. We had the leases signed. We just needed a few more signatures before they were 100%. But that was, I'm very proud of that fact. Everybody's pretty happy. If you ever have a chance to come by, I'll give you a tour and show you just how nice they came out. PLT Construction did the work, APCO did the buildings, and they just came out beautiful.
Our tax assessor know that, Mr. Lamb? Does our tax assessor know we got airplanes in each one of those hangars now?
Yeah, I just recently updated the based aircraft registration with the FAA, and I forward that every year to the tax assessor. Yes, sir.
Thank you.
I was kind of kidding, but I appreciate the update.
I just got a call last week. A gentleman wanted to buy a brand-new Gulfstream 3 and base it at the airport, which would be the biggest aircraft ever based at the airport. It's a big airplane. He called me today, said he sold it to his buddy. He bought another one that's even bigger. They both want to locate at our airport. I get a call like that just about every week. Somebody wants to base their aircraft there. And with airports, it's build it and they will come is pretty much how it works. Oh, there we go. Self-serve fuel farm. That'll provide after-hours fueling for Jet A and Avgas, 100 low lead, transient-based aircraft. The airport's never had a self-serve fuel farm. About half the airports out there nowadays, especially GA airports, have self-serve, so this is a nice addition. It increases our capacity of fuel, and this one is state-of-the-art. It's got a touchscreen kiosk, and it will have both single-point and over-the-wing Jet A fueling, which is very convenient for jet aircraft. And here's a great picture of our brand-new runway. You know, our previous runway was many, many years old, and it was in very poor condition. But now, thanks to all those grants and a fantastic construction project, that runway is brand new. It's grooved. It's over 7,000 feet long. It's very attractive to corporate aircraft and any industry in the area who's looking to come here and fly in and out to visit. This is the runway that they're going to use for sure. We also had a chance to upgrade the runway to the current FAA standards while we were at it, and we were successful in doing that and bringing the project in ahead of schedule and under budget. While we were at it, we were able to build a new apron to connect the 2 existing aprons, the terminal area apron and the general aviation apron. And with that came a lot of extra tie-down space and better efficiency and connectivity through the airport. So that turned out fantastic. Same contractor that did our runway taxiway project did that apron, and it's really made things a lot easier at the airport. Part of this project was to build a new perimeter road around the entire perimeter of the airport. We used recycled materials from the runway to build this, and we stockpiled the millings off the old runway and then built this perimeter road. And now we're able to patrol around the entire perimeter and mitigate any wildlife hazards very quickly and easily, to the point that it helped earn us the General Aviation Safety Award for 2019 from the FAA Southern Region. As part of our application process, we included this in there, and I think it was most impressive. That project also gave us all brand-new taxiway pavement, and you can see a a picture here I took. That's our new retroreflective markings on the ground. These help a lot at night for pilots, during the day too. It helps reduce runway incursions. And if you've ever been to any other airports, one of the first things you notice is the pavement markings are old and faded. Ours obviously are brand new and beautiful, and a much safer situation for operations. The new taxiway lighting and signage project was completed as well last year, and this makes a big difference. It's all LED, and it reduced our operating costs on utilities tremendously. It makes flying in and out of these airports at night much, much better. When you can see all the lighting and you can see the signs very well, it's easier to navigate, especially if you're not unfamiliar with the airport. So it makes it very attractive. As part of the runway project, we also saved enough money that we're going to actually be able to do a change order with the state and replace all the runway lighting with LEDs as well with the leftover money on the grant, because they want us to spend it here at the airport. So that's coming next month. While we were doing the runway, taxiway, and apron paving projects, we were able to convince the FAA to come in and replace our approach lighting as well. This was a multi-million-dollar replacement project that they endeavored upon, and while they were at it, they replaced our ground-based navigation systems, our localizer at the other end of the runway at the same time. So it's a state-of-the-art ILS facility now, instrument landing system, which helps a lot when it comes to itinerant aircraft coming in that need a safe navigation aid to get to the runway in bad weather. So what else is new at the airport? Well, we've been really busy. The FBO contract expired last year, and the airport took it over as exclusive operator to the fixed-based operations, which means the airport has control of all the fuel sales and all the airport hangars and leases as well. Since we took over, we reduced the fuel prices and noticed an incredible increase in operations. And we were doing really well before COVID-19 hit, but after the last couple months, we were back to pre-COVID volume sales over the last 3 months. And we are actually able to navigate through that and still come out in the black for the year, for the first fiscal year operating as the FBO. So our revenues exceeded our expenditures for the first year, which I'm very proud of my staff for making that happen. You can see a picture there. That's a Pilatus PC-12. That aircraft is based at our airport. One of our local residents owns and operates that airplane. He owns 2 airplanes and buys a lot of fuel from us. But you can see a glimpse of our ground service equipment there that we purchased as part of our first year in business. So we did have a lot of expenditures to account for, which we won't have next year. So we're looking forward to an even better year next year. There's a picture of our staff. We hired several new employees to help us with this fixed-based operation. We've basically tripled our employees out there. So we have a great staff. We get a lot of great compliments for the work they do and for the friendly service they give. So we are very proud of our people. They really make the difference for our customers. We renovated the terminal area inside and provided a new retail area for pilots, and we sell, pilot supplies and snacks and refreshments and those type of things. Make people comfortable when they come by, and it's kind of refreshing. It's a bright, friendly place to come into, and when you first land here in Nash County, this is what you see, and I think it's a great representation of our county when we have really nice facility to visit. There's another glimpse at our FBO equipment. When we took over one of the hangars, we utilize it now to store all of our ground service equipment. And we've got state-of-the-art jet porter for jet aircraft, and we got people movers. And part of the fueling contract, we were able to acquire brand-new fueling trucks as part of our contract. So all these things combined create a lot of confidence with pilots and aircraft owners when they come to our facility, when they see new equipment and they see that everything is well taken care of. And of course, the friendly staff helps tremendously as well. That new T-hangar facility basically tripled our based aircraft on the field. We went from 13 to 40 based aircraft in just 3 years, but most of it is in the last year since we added these T-hangars. And there's a few pictures of some of the new aircraft that are on the field. And a couple of them have been here for a little while that were waiting to put their airplanes in these T-hangars. This T-hangar construction freed up a lot of room in our transient hangar, so now we can accommodate bigger aircraft that want to be based at the airport, like that Pilatus. The new flight school out there, Fly RWI, has acquired another aircraft, so they doubled their aircraft. And they've trained dozens of pilots over the last couple of years for their private pilot license. There hadn't been a flight school at the airport for over a decade, and so this was a little bit of a pent-up demand as well. But had some pretty good success with the flight school, and a lot of happy faces when we take them up flying for the first time. They didn't realize that there was a flight school here at Nash County, and when they find out, they can't wait to come out and try it out. So what else is next? Well, we're looking at a future terminal area expansion. Our engineers have prepared that as part of our strategic master plan for the state. The airport layout plan and strategic master plan is a document the state requires us to update every decade to show what the airport plans to do over the next 20 years. And with that comes eligibility for the funding. So when you're able to update this master plan, you're able to qualify for more funding for more capital improvement projects. So we were able to update our airport master plan, and we actually completed half of the proposed projects on the master plan in the first couple of years. But the terminal expansion is one of them. This will increase the ramp space and the terminal area for larger corporate jets to be able to come and park and stay the night. And this is the reason why we get plenty of transient jet traffic at the airport. And here's just a couple of glimpses from a few days last year showing what kind of hardware is parked on our ramp. We're also looking closely at a corporate area development, phase 1, 2, and 3 to the north of the airport on the property that's contiguous between Highway 97 and the airport property. This will allow us to park much more expensive aircraft that contribute tremendously to ad valorem taxes. But like I said, this Gulfstream customer that wants to base his aircraft, that aircraft is a $3-4 million aircraft. He wants to bring 2 of them, and with 67 cents on the 100, that adds up quickly. So if you build 30 hangars that fit those type of aircraft, you really build up your tax base fast. Now, I've had to turn away quite a few large aircraft that wanted to base here, but we just didn't have the hangar space for them. But if we plan it and ask for funding in the future, there's a possibility we may be able to build it. These are the type of aircrafts that are calling me and flying in and asking to base here at the airport. Gulfstreams, Challengers, Cessna Citation Latitudes, and the like. These are all corporate entities that come in interested in having an industrial presence in the county. And I've got a long list of those transient aircraft owners. If anybody's interested in that, I can provide that. What else is next? We're seriously looking at an aviation industrial master park on the other side of the airport. This would increase operations dramatically. It would create a logistics hub for this part of the state that has a huge pent-up demand. An aviation industrial park master plan would include a feasibility study that would analyze whether or not this would be a good investment to make. And we don't want to pursue anything unless it makes sense. We don't want to chase good money after bad, that's for sure. And the reason we're doing this is we get freight operations at the airport, cargo and freight operations, and here's a few glimpses of what's going on over there. They usually come at night or right around dusk or in the early morning, but a lot of our business through freight is through CDC, and they like to transport turbocharged engines all over the world, but they also bring in a lot of parts, and that's one of our main customers. We've been getting a lot of great reviews lately. The past year operating as FBO, we've gotten over 30 5-star reviews on 3 different platforms, AirNav, 4Flight, and FlightAware, and you can look at them anytime online. Here, I just grabbed a couple when I was making this presentation, but they all pretty much say the same thing. They're really happy with the service, the level of service that they get. They're happy with the fuel prices. They're happy with the facility, and they don't mind saying so. So other pilots and owner-operators see these comments, and they tell me this is one of the reasons why they stop here is because they've seen the fantastic comments, and they wanted to see for themselves just how wonderful it was. And we like to deliver. So with that, I'd like to say thank you for having me and doing this presentation. I invite any of you to come out to the airport, and I'd give you a personal tour and show you in person what's going on and answer any questions. And I've got my chairman, Mr. Gary Hodges, and one of our board members, Mr. Charles Mullen here, and if they'd like to step in and backfill anything that I left out, I yield. Thank you, sir.
Chairman, board members, I just simply want to say that we as citizens of Nash County, we're honored and blessed to have the qualifications in an individual as Dion Paventi. He comes with his credentials are very long and broad. He loves this area. He has served us extremely well. He has brought a tremendous amount of value to this county, and I simply want to applaud him. And I'm looking forward of working with this board and after COVID is gone and having a big expansion, perhaps being a regional distribution center for a lot of major corporations in the future. We have to have a goal. We have to have something to shoot for, and we're working on that. Thank you, gentlemen. Any questions?
Yeah. I have a couple of, how are you controlling, I notice I don't see a traffic control tower, but how are you controlling traffic in and out so to prevent accidents and things like that?
In the FAA world, there are standard procedures. The vast majority of airports in the United States do not have a control tower. So part of our training is a very consistent, and in other words, I follow a set of rules when I'm coming to an airport of announcing where I'm at, a type of pattern that I fly into the airport. So whether I'm here or Louisiana or in Kentucky or wherever, I'm following a same set of rules, and all pilots everywhere adhere to those standard rules which prevent accidents most of the time.
Okay. Another question, this has been one of my interests, I know ever since I've been on the board and even before, is growing that airport. what's the possibility, are you looking at in the future, maybe starting back with commercial flights in and out?
Well, right now with COVID, commercial flying is down about 80% worldwide. Prior to COVID, back in the early 70s, I believe, if I'm not mistaken, the United States government stopped subsidizing airlines for traffic into rural areas. At approximately the same time, the airlines put together a hub and spoke method that we're still employed today, i.e. the Atlanta market or the Chicago market, Cincinnati, Charlotte, and places like that. And when Southwest Airline came to Raleigh-Durham, it was more cost-effective for people in our market to simply drive to RDU to catch a Southwest flight anywhere in the United States, as an example, as opposed to taking a commuter flight out of Rocky Mount, flying into the Charlotte hub, and then departing from Charlotte from there. Notwithstanding that, prior to COVID, the amount of traffic was so high. You have classifications of airports, like Charlotte is a Class Bravo, Class B, which means it's extremely busy. Atlanta, Charlotte, Chicago are examples of Class Bravo airspace. Raleigh had more, it was a Class Charlie airspace, which meant it wasn't quite as busy, but Raleigh was having more originating flights starting out of Raleigh and Charlotte. Even though it was more traffic, it was mainly interconnecting from one flight to another. So it was conceived that perhaps Raleigh would have gone to Class Bravo airspace by a designation because of traffic level. And had that occurred, the feeder airports like Rocky Mount would have picked up a commuter airline. For example, in Charlotte, Allegiant Airlines could have very easily gone and been based at the Charlotte airport itself, but they chose Concord and just spent $50 million putting a whole new base of operation in Concord because of Class Bravo airspace. It has to do with traffic volume counts, and of course COVID has thrown a monkey wrench into a lot of that. So to answer your question, that's some history, but to answer your question, when traffic levels come back up, yes, we can have commercial airline service, but that's a whole different set of circumstances and fundings, and that's I hope I answered your question.
Mm-hmm. Yeah, I asked it because Greenville's still doing commercial flights.
They were until, I think, just recently, because of COVID, they just lost, correct me, they did. Greenville just lost their 2 flights a day, commercial flights, because of the downturn in traffic. And Greenville, had Rocky Mount been 2 hours from Raleigh-Durham, we would have had that service. But we're only a 1-hour drive, and it wasn't cost effective for a Southwest or any other supporting regional airline to be in here and be based solely on the numbers. However, as Dion indicated earlier, we have over 30-some thousand operations, landings and takeoffs right now at Rocky Mount Wilson Airport. And I see us, a lot of people don't realize the industrial traffic, which is very important. And for us to have an industrial center, a regional distribution center here, and I'm talking about very large jets, a second runway, even bigger than the one that we have to cover that. My grandchildren, should the Lord tarry, will have that, and I think we should work towards that goal. And I'm excited about our proximity. We got one of the best locations on the East Coast. Sure, Kinston is a tier 1. You got Spirit Airlines building aircraft parts, but we can very easily be the tier 2. And if we don't become it, it'll go to Johnson County or somewhere else. So I think we need to do all that we can to have that here, and opportunities for our citizens in our area to do that.
Yeah, I've always had an interest in that airport and its success. So
And thank you.
that's why my questions, distribution might be a great thing to take a look at, being a distribution center.
Thank you, Mr. Bittman. Any other questions, comments?
I have just
Yes, Mr. Outlaw.
maybe a comment and a question. First, I want to thank you and Mr. Mullin and Mr. Pavente for being here today. I think as a board, as a county, we really value what that airport means to this area. It's a great asset, and it's only become better since Dion got here. I think everyone would agree with that.
Amen.
But with that said, he mentioned a couple of expansions, one on both sides of the airport, and I think you mentioned that you would need some land on the Highway 97 side. Can you elaborate on those two expansions just a little bit? What would be included in that, and kind of what the timing, your expectations for that would be? And do you have adequate land on the other side?
Yes, sir, Mr. Outlaw. The land that we're looking at for the corporate area development is the first phase of it is actually owned by the Airport Authority now, so we could get started with that. The second phase is owned by the county that was recently purchased about a little over a year and a half ago in anticipation of possibly building the second phase on that as well. The land on the other side of the airport is not owned by the Airport Authority, and that would take an awful lot of planning and coordination, and that's where the feasibility study would come in, would identify what the cost would be and how that we could make that happen if we were to try to acquire that land and put anything into place there.
So in the event someone other than the airport wanted to develop that property, have you got a plan that you have shared with anyone, so it would be at least we would have knowledge of it before something else might take place to disrupt the long-range plan?
We're so preliminary in that we haven't even started a master plan yet. We're asking for money just to do that. This is something that's just brand new that we've only considered because of the possibility. So we've been coordinating with Nash County Planning Office and talking about it as part of the Nash County Master Plan. And part of the aviation, the airport layout plan and strategic master plan identifies some of those proposals as well. But we couldn't afford to do the entire airport aviation master
Well, I
plan.
know
as
there's
part of
some
that.
development going on in that area, and I would not want down the road for you to be landlocked and not be able to realize the potential of the airport.
Yeah, that's been the bane of airports in the past. Raleigh's a perfect example. They allowed encroachment around the airport and heavily residential encroachment around the airport, and it's restricted them to build any future parallel runways in that direction. Of course, they're bounded by the south by the state park, which they can never build on. So they've basically eliminated all their ability to expand.
I just think, understanding that, it would probably be a good idea to give someone, the manager or someone, some insight into what your long-range thinking really is before we have that encroachment problem that you spoke of.
We did. We met about 6 months ago and talked about just that.
Okay.
Yes, sir. I will continue to
Great.
bring, yes, sir.
Thank you. Thank you for being here today.
Yes, sir.
Mr. Chairman,
Yes, sir.
I just want to thank the Airport Authority and Dion. This is the fourth small airport I've dealt with, and the difference in our airport 5 years ago and today is just remarkable. And the best thing I think they ever did was go to Elizabeth City and steal Dion away. I do not believe we'd be here right now in the same situation had it not been for Dion and his vision and his support from this board and other boards and his board. But it really is remarkable where we are having the fuel cells, getting the T-hangars in, getting the runway done. There's just been so much done to improve this facility. It really bogs the mind, but I just wanted to thank them all for their hard work.
Thank you, sir. Any other commissioner have a comment on item number 4?
I just want to say, too, that I'm impressed with the airport authority and the director and what they've done in the past 4 or 5 years.
Amen.
Mr. Chairman, just another comment, I won't come to the mic, but keep in mind, I know you know this, Mr. County Manager, that we are trying real hard to self-sustain, which means that unless we come up with a big project, the contribution from the county and the cities will cease pretty soon. So, more money in your pocket.
Yeah, I like that.
We know what self-sustain is, Mr. Butler. Don't have many of them, but that's great. Mr. Outlaw, if you want to continue with item 5.
Okay, again, thank you for being with us today. It's a good presentation.
Absolutely.
Today, for our inside presentation, we have some people that are very familiar to this board. Mr. Brian Brantley, who's our Emergency Services Director. With Mr. Brantley today are Adam Fisher, Nikki Joyner, all our EMS station officers with community paramedic duties. Within EMS, Brandon Taylor, who is also with Mr. Brantley today, has been designated as the Community Paramedic Coordinator. Also with us today is Jamie Dickey, EMS Field Training Officer. She's a reserve community paramedic, and this is a program that is near and dear to me. It's a great program, and I hope that without revealing any specifics, that Brandon, if he makes the presentation today, will share some things that would show you the real value of this program. So with that, Mr. Brantley, welcome, and welcome you folks with you.
Get too aggressive there, Mr. Manager.
Yeah. You got this? You got anything on?
Brandon did.
Okay.
Thank you. Thank you, Mr. Outlaw. Thank you, Board.
Good evening, sir.
Certainly look forward to this opportunity as we've got some great employees in our community paramedic program, as we do throughout all our divisions. But I want to thank them for what they've done. 7 years ago, it was a vision. There was some community paramedic programs starting around the country, and talked about it a couple of years, and then Brandon got really involved in it and really went to work on it, and he's had some great help with these other employees. I don't know if he talks about it or not in his presentation, but they have to have some additional training. I do know Brandon and the group have put together another training program that we hope to get some additional reserve community paramedics like Jamie is. And some of that training is crisis intervention, medication management, and substance abuse. And they do a great job for us. And as a citizen of Nash County, it's a pleasure to know we've got this program because it has made a huge positive difference in a lot of people's lives. And I want to thank them publicly, and I'll turn it over to Brandon.
Thank you, sir.
Now you can get wet.
He done started the program for you there.
Slim started, got me way ahead here. Let's see. Thank you guys for having us. I could probably talk for days about our program. I've When we started this thing, we worked, like Brian said, for about 2 years before we were able to get it together and figure out exactly how we were going to run it. When we did start, and it's in our slide, but when we started, there was only 5 programs in this whole state doing anything similar to what we're doing now. We kind of looked at, in EMS, we pick people up, and then you start to realize that we're picking people up over and over and over again. And there's a reason for that. A lot of times it's a mitigatable reason. There's a issue that we can work with that patient, with their family, to keep them out of the hospital. There becomes a point that Medicare insurance offices, they don't pay for the transports anymore, so we're actually losing revenue by transporting them to the hospital. So we sat down, we looked at this program. It's been a big learning curve for us. We were taught to treat emergencies, and now we're treating things that are not necessarily an emergency, but it's still something that our community needs. So I'll get into our presentation. Again, thank you guys for having us today, and thank Nikki, Adam, and Jamie for being here as well. I'm going the wrong way. So in 2015, again, like I said, this was a program we worked on. We didn't have a specific truck for us to start this program with. This was a repurposed truck that had, I guess, 160,000 miles on it. I think we had a few rats that were living in it. Seats were chewed up a little bit on it, but it got us around. A couple years into it, we were able to replace it. And I'll show that when we get into it a little bit further. But the way that we were able to start this program, it didn't cost anybody in the county anything. We were able to get a grant. We worked with UNC. I sat down with them, told them kind of, hey, this is what we want to do. We see a gap in the healthcare system in Nash County. We did a lot of research on what our demographics were: high school dropout rates, high school success rates, who had access to primary cares. One of the biggest things we saw in this county was that one person to every almost 1,800 people had access to primary care, or we had primary care patients. So we had a lot of patients with very little primary care. So when you call your primary care and you want to go see them, 2-3 weeks sometimes is how long it takes you to get in. After speaking with them, looking at that, we were able to kind of form our program to fit the needs of our county. So we were able to get a grant to begin this program for around $430,000. That was for funding for 2 years. That was through the Duke Endowment. That program also funded, that money also funded a transitional nurse manager that we were dealing with there at Nash. Our referrals for the program came directly from this transitional nurse. She went through the referrals, decided it was a good patient, and they would send it over to us. So with that Duke Endowment grant, obviously with partnering with the hospital, initially our biggest goal was to work with the hospital to help Nash County citizens. As we progressed, the 3rd and 4th years, we were able to get a grant through the Community Foundation Fund of Nash UNC. That was for $150,000 each year. That partially funded, originally when we started, Adam and I didn't say this to start with, but Adam and I were our first 2 community paramedics. We have 3 shifts, so that left us with 1 shift that was not staffed with a community paramedic. That was kind of interesting in our initial, because we would hand off patients each morning, and some mornings there was nobody to hand off, so we kind of had to do a lot of work on the backside to keep those patients taken care of. In that year that we were able to go to the community grant, we were able to get a 3rd paramedic, which is where Nikki came in. She's our full-time on our C shift, which helped us close the gap. We had someone there 24 hours, 7 days a week. Holidays, there's somebody there for these patients to reach out to. This year with COVID, as COVID started, it was around the grant season. Normally that comes around April. We put in the grant in May, and they kind of tell us, in June, July. But they rescinded that money due to the revenue loss at the hospital, so we were not able to get that grant this year. We sat down, we looked at the benefits of the program, what we had done with the program, and we were able to change some positions around, move some things around, and keep our program. So when we look at our goal, we had to change some things. Obviously, we're not getting money from the hospital, so now we need to focus on something different that fits our county and helps our citizens, and that was kind of a repurposing of the community paramedic program to focus more on things we knew we could do for our citizens. This was the truck we were able to get in 2019 to replace our other truck. That truck was very welcome because I think we stayed on a backup truck probably 60% of the time that year prior to because of mechanical issues. So this truck has been really great for us. So far we've not had any issues with it. So all of our trucks, all of our QRVs are stocked with all ALS supplies, and you can see this picture here. It's kind of stacked in the back. It was a smaller vehicle than what we usually use. We've got all of our equipment in here, but it's kind of packed, but it helps out to be able to get, we have a screen in the middle so that nothing comes up to the front there, but we're able to do anything an ambulance could do. We just can't transport. We've got all the ALS equipment that they've got as well on our truck. So. And thank you, commissioners, for allocating that money for that truck. It was very well needed. So what does our program look like today? We kind of readjusted, and we know that we have those patients I was speaking about earlier that call 911 a lot. We call them frequent EMS or familiar faces, people that we know we're going to see because they're going to call at least 3 to 4 times a month normally. We're working with our overdose and substance abuse population. We know that there's still an epidemic going on. Sometimes you don't see that in the news because of the other things that are going on, but we know that in Nash County we're still having multiple overdoses a week and month. Social determinants, that's kind of a broad category. That's people who are living at home that don't have really any social networking, no spiritual networking. They may be living in a subpar living conditions. Maybe they're just not able to take care of themselves. So there's a lot of different indicators that will put that person in the social determinant category. Acute call response is we would respond with our ambulances, and I'll get into that a little bit more. Disaster response and the COVID response has definitely changed our lives since this has been going on, as I know it has everyone's. So our frequent or familiar face patients that we would see, people who are at home, they don't have any family, they may have issues with their medications. They're not able to either get their medications, they don't know how to take their medications, or they're taking too many of their medications. And I've got some success stories here at the end, and we'll kind of talk about how we could make a difference in that and how we have made a difference in that with our population. New diagnosis of disease, if you've been to the hospital, if you've been diagnosed with anything, or if you've had any kind of medical condition, basically, if you've been admitted, they tell you this is what's going on with you, this is the medications you need to pick up, and they send you home. And if you don't have access to someone who can help you with that, it may be overwhelming, and eventually what will happen is you don't do what you're supposed to, and you end up back in the hospital. And that's the kind of thing we're trying to prevent for our Nash County citizens. Or a patient who doesn't have primary care and is using the emergency department for their primary care. Our overdose patients, we've had, over the last 5 years since we started this program, we have multiple patients that have overdosed, and we've had a lot that have died here in our county. And it's not it's a long-term impact on our providers, the family, our community, and we decided that we needed to do something. Whether we're doing the right thing, I'm not sure. I think we're helping patients. I don't think there is a right thing. But what we're doing with these patients, we work with Mobile Crisis, we work with Trillium, we work with the CARES group. Hope program, when it was here and in full swing, we were working with them. We still work with them some. We've got some urgent care, mental health, and substance abuse facilities that we work with here in the county. Basically, what we'll do is we'll go out and see these patients and try to, during that initial overdose, make a difference. Try to get them to our mobile crisis units, try to get them to go to some kind of outpatient or inpatient treatment at that point. If they will not go for that kind of treatment, we'll leave a box of rescue Narcan. That's not condoning them to get drugs and do drugs again. It is trying to keep them alive until we can talk them into going and getting that treatment. We cannot get treatment for a dead addict. That's just not possible. But if we can continue to treat their symptoms until we can get them treatment, then we have more of a likelihood to make a difference in that person's life. And that's been a different program for us. We've got some employees and some community members that I think agree and some that don't. But the ultimate fact is if we can't keep them alive, we're not going to be able to get them help at the end of the day. So social determinants, again, like I was saying, hoarding houses, patients that are unable to care for themselves, unsafe social encounters or social environments. That's patients like an elderly patient who's being abused by a caregiver. We go in and we try to work with those patients and get them out of that situation or get adult protective services or social services involved. This picture here is a picture of one of our patients, pill pack. It's a blister pack. It was sent from the pharmacy. This is how it's sent to them. When it's sent to them, you can see on the left side, I can't remember if it's the morning, but it's morning, evening, afternoon, and nighttime. The one on the left is one of the packets that they had started. The one on the right is another packet they had started. If you notice, there's 2 columns when there should be no columns. What happened with this patient is they were calling for 911, they were having blood pressure problems, they were having other issues, and they were directly related to the fact that they were not taking their medication properly. So what we were able to do is get a caregiver in, talk with them, show them how to take them, and then eventually get them on a better medication regimen, which will ultimately keep them from calling 911 and going to the ER, which is tying up our ambulances and our ER for primary care situations. Our acute call response, so if there's a high-level call, cardiac arrest, shootings, traumas, motor vehicle accidents with multiple patients, we respond as well with our ambulances to those. Each of our paramedics, our community paramedics, have about 15 years on the job. We've been through some extra training. The mental health calls, the substance abuse calls, we have the crisis intervention training that we talked about. That's a 40-hour program, plus our normal paramedic program that teaches us how to interact with dementia patients, Alzheimer's patients, autism patients, substance abuse patients, patients who are in psychiatric issues where it may be suicidal or homicidal. It kind of gives us an extra step in how to approach them and deal with them and de-escalate those situations that sometimes our crews on our ambulances don't have that extra training. All of us have been through it, and Jamie has been through it as well. One of the advantages of being on a quick response truck, if one of our ambulances calls for assistance and needs an extra set of hands, is we're not tying up another ambulance. We're tying up a QRV, which is one person. So we're not tying up a transport resource, we're tying up a paramedic. So we'll get on the ambulance with them, ride in, instead of, it would be 2 ambulances being tied up, not able to respond to an emergency call if there was one in that area. The other thing, our facilities in Rocky Mount and here in Nashville will call sometimes, excuse me, needing IV starts. We would normally tie up an ambulance for that. That's normally 45 minutes to an hour worth of tie-up time that we're handling for the agency, so that we're not tying up ambulances for that. So that keeps that ambulance in service for a emergency response. Disaster response, we deal with our highest risk population in the county. So as a disaster, whether it be man-made or a weather disaster, we know who these patients are. We know where they live. So we're able to check up on them after the event or during the event to make sure that everything is okay, that they have the oxygen they need, the medications, electricity if they don't, or we can get them to maybe a shelter, that kind of thing. We have, during the last hurricane we had, we helped set up the special needs part of the shelters for the people who were on oxygen, the people who needed medications and that kind of thing. We were able to go in and help set that up for the evacuees. So our COVID, I think it's changed everybody's life in here. I know it changed ours pretty much overnight. We were doing all of this stuff that you saw here, and then overnight we had to decide how we were going to decon trucks. As an agency, one of our busiest stations, obviously as closest to our hospital, is our Rocky Mount Station 800. So we kind of put a plan in place. That plan was that when you leave the hospital, if you need to be deconned because of an exposure or possible exposure, you come by 800. The process is very long and kind of step by step. So we're there at 800, we're in Rocky Mount, so we were a part of it. What we do is we will help the people decon themselves. We decon their ambulance after they have wiped everything down. They get showers, we put out the protective equipment for them. And it's normally 45 minutes to an hour, maybe 2 hours, just depends on how much is going on with that one call to get these people decon. I think at last check, I think we're doing 30 now a week, 30 decons a week. I think at the peak, it was maybe like 75 or so, I guess, maybe a week. We were doing 8 to 10 a day. And that's kind of slowed down just a little bit with the decon. So. Some of the other COVID-related things we've done, there's been a couple of patients they called 911. Their only reason for calling was to go to their primary to get a COVID test. So instead of exposing the crew, we sent one of our paramedics, Adam was the lucky one that went over and did this one, to do the swab. We did the swab, we were able to keep it, carry it to the primary care physician. They were able to do the test, which kept a truck in service for an hour. It also lessened the exposure of our employees just to one. We already knew this was a possible, excuse me, COVID patient, so we were able to completely gown up and know that when we go in to take all the precautions for that. Decontamination of our stations, if we've had some kind of high-risk exposure on a crew, we're able to go in and do those stations, decon everything in those stations. We pass out the PPE, again, like I said, the personal protective equipment. So, other duties that we have been involved in, public education plans, medication dispensing to our crews as they come by 800 and need a certain medication, we're able to give those out. We've worked with several healthcare entities, our health department, the OIC, and I've got a full list of those in just a few minutes. And then one thing that has helped out a lot of our primary care partners is that we're able to do blood and urine specimens. So if you've got a patient who can't make it to a doctor's appointment for travel because they can't drive, they don't have a family member, we're able to go out and do the blood draws for those patients and urine specimens and be able to carry those back to the primary care, drop them off at the lab, and then they can interact with that patient without the patient actually having to make it there. So instead of the patient sitting at home wondering if there's an infection going on, we're able to get that blood to the lab so that we can go ahead and start treating it, call in antibiotics and that kind of thing. So some of our partners, and this is just a very short list of partners, Boyce Willis Clinic has been one of our biggest primary care partners. We've been able to work with them and do a lot of things. They're currently looking at ways they can integrate us into their billing so that we can bill for our services through them. OIC Clinic in Rocky Mount, we've worked with them a lot. The CARES Foundation, the Hope Initiative, Rocky Mount Family Medical, obviously the Nash UNC we've worked with. The Heart Center, we've kind of got a different relationship with. We're able to work with them with their congestive heart failure patients. Eastern North Carolina Medical Group has been a part of it. And like I said, there's home health agencies, and then I'm missing probably 100. There's many partners that we deal with to keep this all going. So I'm not going to go through this whole slide. I'm going to kind of go into what we have done, the success stories that I was talking about earlier. This patient, we've worked with 1,000 patients or more. I don't know the exact number right this second off the top of my head, but it's over 1,000 patients. When we were working with the hospital, we kept our readmission rate was lower than 20%, 20 to 20, below 20. The hospital's readmission rate had always been higher than what we were doing. So their transitional department, which was responsible for readmission, we kept ours at 20. Our goal when we started the program was 16 to 20, and we were able to keep it within that range. For the majority of the time, I think there was 1 or 2 months we may have went over, but we were able to keep a lot of patients from going back to the hospital for non-needed readmissions. One of the, and this may not seem like an impact, I put it in here and I debated on putting it in here. We've been mentioned in several obituaries, and that doesn't necessarily sound like a good thing. But for a patient and a family that in their last dying hours and to remember us and the care that we were able to give them is pretty strong, and it kind of, I know it's affected us. We've got cards, and I think we've talked with them. It's to know that we did that good of a job to provide care for that family and that patient, I think speaks volumes for itself and what we were doing with the program. In 2016, we were awarded the North Carolina Association of County Commissioners Award, Innovative Award and Excellence in Innovation Award. That was a plaque and a $1,000 check that we put back into the program after we got that. So some of the success stories. Again, I was talking about the medications earlier. This patient the first patient that you see here was a patient that was calling, I think, 9 to 10 times a month. It was literally every week we were going to see this patient. And it was usually in the middle of the night or later into the evening, 10, 11 o'clock. We would go over, the patient was complaining of a certain thing. We'd tell her which medication to take, and she would say, okay, I don't want to go to the hospital. So she was kind of my goal as we started this program. She was one of the first ones I worked with. After going and seeing this patient for a month, I never picked up on it. She called me one night and she wanted me to tell her which medication to take. I asked her to tell me which bottle she had in her hand, and she couldn't. She tried to spell it, but couldn't spell. I found out immediately that she was illiterate. She didn't know what her bottle said. So I left that night, we went and talked with her. I think it was 11:30 at night. And we were able to color code her bottle so that she knew which medication she was supposed to be taking when. And her call volume went from 9 to 10 times a month to one time in 6 months. And that was just, I think she had another issue that was legitimate to go to the hospital for. She actually enrolled her sister, which lived a couple of houses down from her, because of blood pressure checks. We were able to, when I went and saw this patient, we went and saw the other so that we could keep them both at home at the same time, basically. But that was a call volume that we were tying resources up on an ambulance, a transporting ambulance that was sometimes 45 minutes to an hour, whereas I'm not a transporter. I can go sit with this patient, figure out what the issue is, and work on it with that patient. The next one is an example of our substance abuse, and what we've done with that is a patient we had that overdosed. She was revived with Narcan. The EMS crew tried to get her to go to the hospital to be evaluated. She refused. She refused for me to come out, actually. They called me and said, hey, maybe you need to talk to this person. I was able to get her on the phone. We went and talked with her. She actually was transported that night in my vehicle to the hospital and put in a program. While we followed her, we had to help her get an ID. She didn't have an ID, so she couldn't get into treatment. We were able to get her an ID, get her into treatment. She went to live with family in another county because there were so many factors here that we were not going to allow her to go into rehab or to benefit from rehab. And as far as we know, I know she's not back in Nash County because we haven't had any dealings with her at all. The other one is kind of the social determinant kind of situation, and that's a patient who was living in a home that was pretty bad as far as health or as filth. There was pet feces on the floor, urine, there was food, there was trash all throughout the house. This patient was had become depressed because he was lonely. Family lived out of state. He had one daughter that was coming by checking on him that really didn't care to make the arrangements that needed to be made. We were able to get social services involved, the hospital involved, adult protective services involved, and no one really had to do anything. It kind of changed this patient's mind that, hey, I need to do something because all these people are involved. That person is now, after having 3 of his toes amputated because of what he was living in, he was infected. He actually had maggots in his feet and was living at home by himself. We were able to get him help to get that fixed. He's living in a rehab facility in Rocky Mount now and is out of that place completely. We were able to get his family down from Michigan that came down and actually helped us push him into that situation. But our EMS crews, our normal ambulances had tried multiple times. Law enforcement had tried to get this guy help, and we were just able to pull everybody together, and it all kind of worked out at a good time. I think it took 3 or 4 trips over there and hours at a time, but we were able to get him into a situation where he's safe now. So that was definitely a positive. I know I've been talking about what we do and not money that we bring in, and I know that's a big thing when we talk about any kind of program. Medicare, Centers for Disease Control, and Medicaid, they are studying several different kind of programs just like ours. They are trying to figure out a fee schedule, so it is coming. Normally these kind of demonstrations last for about 5 years. Medicare sees the need to treat people in a certain place at a certain time and not always at an emergency department. They're trying to figure out how much benefit these programs have and how much these benefits would cost to run. Once that's done, I think you're going to see regulations change and you're going to see things push more towards a treat at your home through a primary care on a non-emergent situation versus carrying everyone that we pick up and interact with to the hospital, because it's a whole lot cheaper for Medicare and the federal government to do it that way. Like I was talking about earlier, there was 5 when we started. There's 25 in the state now, programs similar to ours, and then there's 15 that are in the building phases. We were lucky enough once we got started that there were several other agencies around that have come and kind of modeled their system off of us. They've rode with us. They've asked us how we started and what we did. I think we kind of struck while the irons were hot, to say. Most of the grant funding is drying up for startup of this program. There's funding for existing programs that we're working on, but as far as starting the program, I think we got into the situation at a good time because there's not very many startup funds available currently.
Would you go back through those numbers one more time you just quoted? How many counties and which ones were new and so forth?
Yes, sir. There's 25 counties currently in the state that have active programs.
Right.
There's 33, I'm sorry. And then there's 15 that are working on getting a program in place.
15 more then?
Yes, sir.
That's the part I couldn't make out. Thank you.
Some of the talks that we've had, some of the ways we are looking at funding, we've been able to talk. There was a home health provider when we were talking about the Medicaid expansion here in North Carolina that was on board. They were excited about it. Unfortunately, that got put on hold. Once that was put on hold, that changed their payer model and the way they were going to be able to pay us for the services. I think if the Medicaid expansion happens, then that's going to open that up more for us to use some of these home health agencies as payer sources. United Healthcare, we've talked with them. I've talked to one of their vice presidents of this region. She is interested in doing a partnership. However, we're looking now at what that partnership is. What is the fee that we would charge for our services to one of their patients? I know that in other parts of the country, there's a couple of programs in South Carolina. Blue Cross Blue Shield is working with their community paramedic programs to pay that because it's easier for us as a local entity to be able to reach out to these patients, and they're actually getting paid through that Blue Cross Blue Shield. ACOs, Accountable Care Organizations, it's several groups of primary care physician groups that are working together for patients. The way that they get paid is by putting out a plan on this is how we're going to treat this patient this year. As long as they stick to that plan, they get paid a bonus. If they deviate from that, then they take a penalty. We've been working with Boyce Willis because they're one of our local ACOs to figure out could we be put into that patient care plan and what it would cost for us to be put into that patient care plan. We're still working on, obviously, on the answers for that. Again, I think we're in a good place with our community paramedic program. I think we got into this program at the right time. I think regulations are coming in the next few years that are going to open up more revenue streams for this program. But as we move forward, we were going to continue, as we always have as Nash EMS, to look at what we can do for our citizens. We want to obviously treat our patients at the right time, at the right place, but we also want to be there as a community to look after all of our citizens. That's our current state of operation is probably going to change as our demographics change. As the healthcare system changes, I think we're going to see a difference in how we're going to deliver this kind of care to our citizens, but there's always going to be a need because there's always going to be gaps in our healthcare system. There's always going to be people who are left behind if we don't go out and find these patients. So I think looking forward, we're going to continue to look to do that kind of care for these patients while we're looking for our revenue sources to backfill our money for what we're doing. Any questions? I appreciate you guys' time.
Mr. Chairman,
Go ahead, sir.
on your decontamination,
Yes, sir.
there, how are you involved in that, just with the individual patient? Are you using medication or just?
So a patient, if one of our, what will happen is our ambulances are dispatched, they pick up that patient. If they have the signs and symptoms of COVID or they are positively diagnosed with COVID, they will take certain precautions on the call as they're transporting. Once they're transporting and offload that patient, they come by Station 800, which is our main Rocky Mountain station. They have a decon process, which is bleaching everything down and wiping that down, and then they come out. We go through a certain process of taking them out of their gowns, their masks, their gloves, their goggles, so that we're limiting their exposure. They'll go in and they take a shower switch uniforms. We launder all of the uniforms there at 800 now. While they're taking a shower, we do a secondary decon of their truck. So we take it's a sprayer we sit inside that basically atomizes all of the disinfectant and it covers all of the surfaces after they have deconned.
So this is with the staff, not
Yes, that's right.
patients?
Yes, sir.
Okay, I
Staff.
misunderstood it when you,
Yep, that's deconning our staff after exposure, yes, sir.
okay.
Any other questions?
I've got just a couple of questions.
Yes, sir.
Brandon, thank you for being here today. Very familiar with the program, spoke with you many years back
Yes, sir.
regarding this program. Did you say that the Nash County program was one of the first 5
Yes, sir.
started in the state?
Yes, sir.
Great, that's great. Do you know what your annual funding needs are? And can you put a number on the cost avoidance that this program provides to the county? For example, you indicated in one of your success stories that the visits went from 1 to 6 per month to 1 every 6 months. So are you able to quantify the savings of this program and compare that to what the cost to the county is for that program?
Yes and no.
Well,
So
it's a great program, and it's a proactive program, and it's one that I believe we all should continue to support. Obviously, it's growing
Yes, sir.
across the state.
So to answer your question on the savings, so there's a backside savings to this that is hard to quantify in actual numbers, and that is the expense that it costs to transport a patient from her residence to the hospital that we're not reimbursed for. We're using gas, we're tying up, and it could be that we're tied up this ambulance and one comes from Nashville to Spring Hope. That's extra gas that fuel that we're having to use. Then we're driving to the hospital and we're driving back. And a lot of times Medicare and these insurance companies are not reimbursing after so many calls. They will look at the narrative of how that report was written, and if it's not a needed medical transport, they don't reimburse us. So you're paying for your employees, you're paying for gas, upkeep on the truck, wear and tear on the backside, and that's where we're saving money at right now.
Well, maybe I should have said cost avoidance.
Yes, sir.
So maybe that'd be a better way to look at it. If a truck is not having to go out to a home 6 times a month,
That's
I mean, that's a cost avoidance. That truck is available
correct.
to go other places. That may be much more needed.
Right, and that was the whole thing that we looked at, was to avoid the fact that this truck was tied up here when really there was someone else we could put there so that there was an emergency in Spring Hope, that Spring Hope truck was available.
Yeah.
Or if we're in Red Oak dealing with this patient, we're able to have that Red Oak truck available. And that's an avoidance of life-threatening, not necessarily a monetary thing, but being able to have our ambulances back in service quicker and being able to not have to come to the commissioners and say, hey, we need extra trucks this year. And Brian, I don't mean to overstep here when I say this, but not having to ask for additional resources, because if we can keep those ambulances in service, then we don't need additional resources. We don't have to add
I just
extra.
think you need to figure out a way to try to quantify savings and avoidance, because obviously that's an important number, I believe. Let me ask one final question on Narcan. You said you keep it on the vehicle. Don't all the EMS vehicles in Nash County carry Narcan as well as the sheriff?
Yes, sir. So they do. Our ambulances carry a different setup of Narcan. So our ambulances carry either an injectable Narcan or an IV Narcan that you have to put an atomizer on, and then we screw it into it. The ones that we carry for our rescue Narcan, which we've got through a grant with CARES, is a very simple use Narcan. Some of the other kits had needles on them that you had to inject. These are just like what you guys have seen for the sheriff's department. We put it up the nose. All you have to teach the patient is to be able to squeeze it, and it delivers 4 milligrams of Narcan. So we carry the ones that are similar to the sheriff's office so that it's simpler for the patient or the family member to be able to use.
Well, maybe you can't answer this, but I'm going to ask it anyway. You said in some cases you leave the Narcan with the patient in the event they need it. Is there a number of times that a person can take Narcan before there's intervention to get that person to another level of service that might have greater impact on that addiction?
As far as regulations, No.
So you can give that Narcan,
Yes, sir. We can over and over. What we see is eventually, one, they find an outside resource, and we're not dealing with that patient as much because you can go to CVS and buy Narcan, or you can get Narcan. You can go to several other drugstores and get it. So what'll happen is we introduce them to that, and we tell them, hey, this is going to keep you alive for now. These are the other resources. We try to tell the family that you can get help here, 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 and here. Eventually what'll happen is they don't want to call us anymore, so the family will go get the Narcan from a clinic or somewhere else, and we'll stop seeing them, I think, maybe 2 or 3 times normally, and then they kind of spare away from calling 911 because the family has figured out how to use Narcan, or either they have got into some kind of treatment program.
it just seems to me as a society, there's got to be a better way to deal with that rather than just let a person do that until eventually they run out of Narcan and they're gone. Crazy.
Mr. Outlaw, to answer your other question, I'm going to let Brian, if you don't mind, on the salaries.
Well, we had gotten $150,000 a year for 2 years, and I think maybe for 2 paramedics before was about 130. So about $210,000 is the cost of that program. And as you know, we lost the funding this year.
But you're looking at ways to potentially, through grants and otherwise, supplement that funding
Yes,
as
sir.
needed.
And we did. We gave up those 3 positions, and Z told me that if I wanted to keep the program, even though we were losing 3 positions, we would just reorganize to a certain way so we could keep these 3 positions on that truck. Another thing they do, if we've got short staff, they do get on the truck like those other 3 people we lost. They were sort of backups when we had vacation and sick leave, and they would get on the ambulance and run sometime when we're short personnel.
I think I'd really try to keep up with cost avoidance, where you
Right.
feel like you're saving money that you otherwise would have needed.
Right. And one thing I was thinking about is we can get with the billing office, like Brandon said, they may pay for Ms. Brantley to ride 3 times, and we can figure out what the cost of that function is, and if the next month she doesn't call us, then we can say, hey, that was 3 times, we didn't spend $320 per call.
Yeah.
So we could possibly look at that, certainly.
Thank you, Brian. Thank you, Brian.
Brandon, did you get some kits from Trillium? Did they furnish the county some kits
Yes, sir, they did.
in June, I believe?
Yes, sir, they did. They've been very helpful with all of that. Yes, sir.
Other questions or comments?
Thank you for what you do.
Thank you. Thank you, guys.
Appreciate it.
Brandon, I do have one question, if you would. You
Yes, sir.
mentioned a while ago that because the news medias have other things to talk about now that we don't see as much in the news, which
Right.
I tend to agree with. Where are we at as far as overdoses in the county versus where we were at our peak? Is it,
So, I looked.
how
at
much better is it, or is it any better?
From May of this year to current, which was last week when I looked, we had was around 130 Narcan administrations. I think in the same period last year, we were probably over 200. It's definitely come down some. I can tell you that from our point of view that we see, I can tell you when a new heroin or a new drug has gotten into the county, and I can tell you when the sheriff's office or the police departments are getting them off. Because of the influx. You can look at one month will be 25 and the next month will be 10. And you can tell that there's new stuff coming in every time that way. And I think that probably one of the indicators is that there's been more seizures recently and in the last year, and it's kind of slowed our overdoses down just a little bit, which is a good thing for us in the county. So.
What do you attribute the slowdown to?
I think the lack of being able to get the drug here.
Yeah, okay. That's what I thought you would say, but I wanted to hear you say it.
Yes, sir. I think the lack of being able to get the drug, because we'll see people that are normally doing heroin that are switching to pills or some other kind of drug that are.
Okay. All right, thank you.
Yes, sir. Thank you, guys.
Greatly appreciate it. Mr. Outlaw, appreciate both of those. I'm sure the board does. They were great presentations for the month. Very, very, very interesting. I'll keep moving. And Brandon, Ms. Wells did have to leave to go to a doctor's appointment reason. We had a little bit of movement while you were speaking. I do apologize for that, but we knew she had to leave. Thank all of y'all for being here today. Okay, we're now on item number 6, which is a public hearing on community development block grant, and I'll turn it over to Ms. McGee at this time.
Hold on, Miss McGee. I've messed
Hold on,
up.
Ms. McGee, just a moment.
Jonathan, are you taking the wheel? Should I go ahead? Yeah, you're good. Okay. Good afternoon. I'd like to share some information with you about community development block grant programs in North Carolina before you hold a public hearing.
Okay.
Nash County is required to hold a public hearing for the fiscal year 2020-2021 North Carolina Small Cities Community Development Block Grant Program or programs in order to submit applications for funding. The purpose of this public hearing is to allow residents or citizens an opportunity to express their views concerning our community development priorities, our available funds, and eligible activities, and to review program compliance prior to the county's project-specific applications to state administrating agencies. And there would be a second public hearing before a specific application. This is just a general public hearing about community development block grants. The federal funding comes from the United States Department of Housing and Urban Development. A CDBG program activity must meet one of the national objectives, either benefit low and moderate income persons, prevent or eliminate slum and blight, or address an urgent need. All North Carolina small cities except for the 24 entitlement municipalities are eligible for these funds, and all North Carolina counties except Cumberland, Mecklenburg, Union, and Wake can apply for these funds. The state receives about 40 to 46 million each year for CDBG, ED, NR, and I funding, and the ED is economic development, NR is neighborhood revitalization, and I is infrastructure, and we've had some of all of those several times. The CDBG program can fund a wide variety of community development activities such as water and sewer infrastructure, neighborhood revitalization, economic development, and special allocations for disaster recovery, such as following a hurricane, and now COVID-19. The Wooten Company put together a nice little summary of available funding in North Carolina, which is in your packet for each of these different types of funding, and I won't review those, but there is one for each of those 5 categories. Formal public hearings are held for each CDBG application round to inform our citizens and residents of the potential project and obtain feedback. And as I mentioned before, that would be the second public hearing for a specific project. We're having the general public hearing today. I'm not going to review any of the rest of the information in your packet unless you have questions. There is a copy of the ad that was run in the Rocky Mount Telegram. Because of COVID-19, there is and our recently adopted citizen participation plan, we will continue to take comments until the close of business on Thursday. That will not be a part of the record, but I will respond to any comments that we get and include that in a file which will be available to HUD. So that is compliant with the regulations as they now are. So my recommendation to you is to hold the public hearing.
You had in your packet on your iPad, the 5 things you were speaking about. Is there any questions from the board to Ms. McGee before I call for the public hearing?
Yeah, I'd like to
Belfield?
ask the question, because I don't think it relates to the block grant program here, but have the staff or any of taken a look at maybe homeless shelters where there's grant money in connection with that we could do something in that area? It seems to be growing, homeless. And I was just wondering if Nash County could either get involved individually by itself or partner with the city of Rocky Mount.
As a matter of fact, last week,
I know we are funding the Bassett Center now. We're putting some money in there. But I'm thinking about homeless, individual homeless. That's homeless with families. Families that are homeless with children. The part that we are funding, are putting money into now. But I was just wondering if anything related to these block grants is related to homeless.
we, it's possible that COVID-19 CDBG funds could possibly be used to assist a homeless shelter. And as late as, I believe, Friday of last week, we were talking with United Way about potential uses for some CDBG CV funding, which is competitive. And that is one option that United Way was discussing, what their needs are. So that's something we can explore as we move forward with a potential application for that program.
Yeah, this is something that I would love to see us explore, what we can do in that particular area.
Well, United Way wasn't on the call. I think they had some problems, but they brought that up to you later.
Yes,
Patsy. Okay. That was one of the things they had on their list.
yes.
Okay, good. Okay. Any other questions? Not, I'd entertain a motion to go into public hearing on this matter.
So move.
Moved by Mr. Belfield, is there a second?
Second.
Second by Commissioner Combs. Any questions on the motion? All in favor, let it be known by saying aye.
Aye.
Any opposed by a like sign? We're now in that motion carries. We're now in public hearing. If there's anyone from the public that wishes to speak on this item, which is, as we said, a community development block grant, we'd be glad to hear from you this time. If you would come down front, state your name and address. Anyone wish to speak? Seeing no one, I'd entertain a motion to close the public hearing.
I move that we close the public hearing.
Moved by Mr. Belfield, is there a second?
Second.
Second by Mr. Outlaw, Ms. Leggett at the same time. Any questions on that motion? All in favor of the motion, let it be known by saying aye.
Aye.
Any opposed by a like sign? Public hearing is now closed, and the action that needs to be taken is we need to have a motion to approve or deny the request.
Move for approval.
Moved by Commissioner Richardson for approval. Is there a second to that motion?
Second.
Second by Commissioner Belfield. Any questions on the motion? All in favor, let it be known by saying aye.
Aye.
Any opposed by a like sign? Motion carries unanimous. Thank you, Mr. McGee. If you would, keep the board informed on particularly the COVID money moving forward on this.
Yes, sir, we plan to come back for a second public hearing.
That's right, you do have to have another.
We figure out that we can
Okay.
utilize the funds
Okay.
that's,
Right. All right, we'll now move to item number 7 on the agenda, which is policy. If you remember, we got a memo a couple of weeks ago about a old policy we had found, I think, in our archives or something, somewhere anyway, and we felt like it needed to be updated a little bit, and that's what this item is about. So I'll turn it over to our assistant city manager. Excuse me, I don't know why I want to say assistant city manager today. It's assistant county manager. No pun intended.
Human Resources Policy Manual that addresses employees receiving gifts and favors from vendors, but we don't have anything that addresses spending county dollars for gifts, flowers, cards, those sorts of things. So a policy has been proposed that would allow for departments to use funds for cards for significant life events for our employees, but would disallow the purchase of flowers and gifts. The policy also gives the county manager the discretion to use county funds in recognition of significant life events for our community leaders and board members or their family members, as long as the purchase is not of substantial value. You have the policy in front of you. We are proposing that it be a sub-policy to the existing policy that I mentioned that we have that forbids employees from receiving gifts and favors from vendors.
Would it be a sub-policy or would
Well,
it
a
replace the policy?
subsection of that. That policy is actually number 12, and this is proposed to be 12.1.
So the other policy would stay there? this
It will
would just
stay,
be
yes, sir.
An extension of that policy?
That's correct.
Okay, I got it. Any questions on that item? You had the policy in your packet. If not, I'd entertain a motion for approval.
Make a motion, we approve.
Motion by Commissioner Combs, is there a second?
Second.
Second by Commissioner Leggett. Any questions on this policy? See none, all in favor, let it be known by saying aye. Aye. Any opposed by a like sign? Motion carries.
Thank you.
ma'am. We're now going to move, before we move to item 8, the gentleman in the back, if I call you Mr. Williams, am I correct or not? Okay, I thought I had met you one time, and it's a little bit hard to recognize people with masks on. I appreciate you being here today. Did you have a question for the board? We don't have public comments at our second meeting each month, but is there anything you would like to ask us, or you just visiting us today? That would be great as well, but I wanted to recognize you, Ted.
I appreciate that. I just made a mistake about what this meeting was about.
Yes, sir.
I really want to come to one where I could address an issue, you know.
Okay.
But I appreciate you guys and the way you handle your business and how professional you are. So I just want, I just thank God for you and pray for you that you keep doing the good job you're doing.
Well, thank you, sir. And we have public comments at the first meeting each month.
Okay.
And that date would be October the 5th, maybe.
I believe so, but I
I
won't
believe I remember that right. It starts at 9 o'clock, and it's first on the agenda. If you wish to speak, just be here and sign up out front, and we'd be tickled to hear from you.
That's what I'll do, sir. I
Okay,
appreciate that.
thank
you
you.
so much.
I didn't want to overlook you being here if you had a question about anything.
Well, I realized I was in the wrong meeting, but I had to hear what was going on, so I appreciate it.
Come anytime.
Thank you very much.
Yes, sir. With that said, I'll move on to item 8, which is special reports and committees. I'll turn it over to the Vice Chairman Outlaw.
Thank you, Mr. Chairman. Again, if you have a report today of any significant items, please share it. If your committee has not met or you have no report, just state so and move to the next item. First on the list is Commissioner Lou Richardson, District 1.
Yes, sir, thank you. Only one is the Spalding Resource Center. They are still operating on a somewhat limited basis, but they are still operating, so still improving a little.
Any questions for Ms. Richardson? Hearing none, we'll move to District 2, Commissioner Belfield. He has multiple committees.
Thank you, Mr. Vice Chairman. The farmers market, the first one on the list, they have suspended Tuesday's opening for the rest of the season. And it's only going to be open now on Saturdays until 1 o'clock, start at 8, from 8 to 1. The juvenile crime prevention one, we had a call conference last week. We got a report on juveniles that are in detention now. Nash County has 10. And I believe 3 of them, as I recall in my taking notes on the conference, that 3 are of the age that they can be put into adult attention out of the 10. I had a question as to, did they think the juvenile court counsel director, if he and the staff think that the COVID virus has something to do with that increase? Edgecombe County also has an increase too, during this time of the COVID virus. His response to my question was that is family situation. Family doesn't have control of the children. And he mentioned to us that some of the parents have just told him, said, I can't do nothing with them. 14, out there at night, 2 o'clock in the morning, breaking in cars. They said they just can't control the children. So that means it drops it on society as a family. Parents can't control the children, and they're teenagers, they're not adults. It says to me that society gonna have to find a way, and the quickest way society find is put them in detention. But that's not a whole lot of help if they're not gonna stay in there forever for the rest of their life. So they come out, then they'll be hard criminals. This is, my suggestion is that we need to start working on some way in a situation where it's a breakdown in family values here in the country now. And particularly, and I hate to say it, but particularly among African Americans, where women have children in the absent husband or father. And if we don't do something as a society, we're losing generations that just gonna be lost by the wayside. And I express my concern about it. Any question or comment on that particular issue?
Ms. Belville, you said 10, is that a higher number than you normally?
It's higher than.
What is the number normally, as an average?
Well, 3.
3, okay.
My next report is on the Upper Coastal Plain Council government. I was hoping Patsy would stay here. We went over a lot of things, but one that I want to report to the board is the Upper Coastal Plain Council of Government is filing an application for $20,000 for broadband, and they're going to distribute $4,000. There's 5 counties in the Upper Coastal Plain Council of Government, and they want to give each county $4,000 in connection with working on broadband. So Patsy may already know about this. She may have already been notified by staff, but this was the report we got in our call conference. Any questions on that? Our Tar River Transit has not met. The need we have met, and nothing earth-shaking, but we are looking at a personnel matter in connection with need now. And actually, Stacy could probably tell you more about that than I can, because it's a committee, and she's on that committee. But I don't think they're ready to make any kind of recommendation yet, so.
Personnel matter, we might not need to know.
We'll just leave it at that.
Okay, sounds good.
So that is my report. Oh, Head Start started in September through need. They got that going. They have sanitized all the Head Start buildings and everything. pretty high cost too to do that. But they had to do it. I think I believe it was $65,000 or $75,000 to do those 3 Head Start buildings.
Thank you, Mr. Belfield. Good report as always. Anybody have any questions for Mr. Belfield? Hearing none. District 3, Commissioner Dan Cone.
Trillium has met on a regular basis, virtually. We met the last time, I've talked to y'all before about the Senate Bill 808, where Trillium will start handling the entire needs of their worst patients, and the ones that they call low to moderate risk patients will be handled by insurance companies, and 5 insurance companies has agreed to do it. It won't be taking anything away from Trillium. They'll just be handling it in a different manner. They'll be handling the worst patients, but they'll be handling all their needs instead of just the mental health needs. So it's a change, and that bill has passed. It's moving forward. They say it'll be live by July the 1st, 2021. Trillium's still handling them because the insurance companies, this is what they call a tailored plan, but it's not all set up. So they are handling it, but there will be some changes in the cases that they handle and the way that they're handled. Like I mentioned a while ago when Brandon was talking, Trillium distributed 660 naloxone kits. That would average about 25 kits per county that come from Trillium in June. That's, they're working, COVID has made it hard on them too, and they got a lot of people working from home and doing virtual, and they're doing text messages to patients and stuff like that. So they're working around funding and how to handle these patients and trying to social distance, and it's been a burden on them, but everything's going well. The Ag Advisory Board did meet one time. I could not attend that meeting, but the purpose was to approve some applications for some farms that had asked for voluntary ag district accreditation, and the Human Services Board has not met.
Thank you, Commissioner Cone. Anybody have any questions? Hearing
And that's
none.
because of the COVID, I'm sorry.
Thank you, sir. Hearing none. District 4, Commissioner Leggett.
All right, I've got a couple boards to report on. The first one is the STEP Board, Strategic Twin Counties Education Partnership. They met virtually on August 18th, primarily just to discuss the organization's operations and finances. We were able to receive updates from all the local education entities, Nash County Schools, Edgecombe County Schools, the 2 community colleges. One project that they are currently actively involved with is trying to partner up local businesses that have free wireless internet and offering that to students who are in need of connectivity. Next, the hospital board, they met on September 3rd and will meet again on October 1st. The hospital is currently working through a master facilities plan process, looking at their long-range facility needs and plans. And also, they are continuing to actively recruit physicians to meet the community needs and future retirements of current physicians. And through this whole COVID process, they're working to actively serve our community, with excellent service. The third committee, Natural Resources Resilience Committee, has not met as of yet.
Any questions for Commissioner Leggett? Hearing none, thank you, Commissioner. District 5, I've got 3 committees the RPO, Upper Coastal Plain Rural Planning Organization. The last meeting was a Zoom meeting on September the 9th. There are no significant items to report. The next meeting is scheduled for November. Nash Community College Board of Trustees, the last meeting was July the 20th on the campus of the college. No significant items to report from that meeting. The next meeting is a Zoom meeting, which is scheduled for this evening. Nash County Broadband, last project meeting with Cloudwise, the county committee and county staff was a Zoom meeting on September the 3rd. Ms. McGee, as always, has provided me with a written update for the status of that project, and I will leave a copy of that update in your mailbox before I leave today. And I want to thank Ms. McGee. She's not here, but she knows how much I appreciate her staying on top of this project and putting all this information together. The next project meeting with Cloudwise is a Zoom meeting, and it's scheduled for September the 29th. Any questions? Hearing none, Commissioner Wells had to leave for a medical appointment. So, Chairman, I'll turn it over to you for your reports, and then back to you.
Okay, I'm on two committees here. Tourism Development Authority has not met since January, have nothing to report there, and Rocky Mountain MPO has not met this year due to COVID. We did have a scheduled virtual meeting last Monday, and it got canceled at the last minute for the reason, whatever Rocky Mountain issues are with their internet. They couldn't conduct that meeting. I did make an offer that we could schedule it through the county if we need to, and I have not heard anything back from that offer yet. So Bob tells me we don't have anything pressing, but a little bit concerned about that. I'm going to keep following up on that because we really haven't met all year yet. But that said, that would finish up the reports. And is there anything else any commissioner or staff member wishes to bring forward at this time? Mr.
I'd like
Bellfield?
to make a comment now, Mr. Chairman.
Sure.
You probably read in the paper about the city of Rocky Mountain with their, some of their projects that they're having, that they want to be an application that's going to the, what do they call it?
LGC. Local government.
Local.
LGC.
Yeah, right.
Yes, sir.
Councilman T.J. Walker had a town hall conference by phone, and
Yeah, we
I got an
read about you in the paper, sir.
yeah, I got an invitation to participate. Councilman Daltrey was on it also, and Mayor Robertson.
Right.
I was speaking comments that I made as a taxpayer of the city of Rocky Mountain.
Fully
Taxpayer
understand,
on
sir.
both sides.
Yes, sir.
Councilman Daltrey referred to my comment as Nash County Commissioner, which he shouldn't, because I didn't state it that way.
I think I heard that, and I think he identified you as Nash County Commissioner.
Yeah.
I don't think he stated how you presented the comment,
But anyway,
but I understand.
Councilman Andre Knight
Yes, sir.
thought I was speaking for Nash County. He wanted Nash County to stay out of business. I plan to talk to him at their next meeting.
Right.
And tell him I'm a citizen of Rocky Mountain. I pay taxes in Rocky Mountain on both sides of the track. And I have a right as an individual.
You do.
And I got better sense than to go up there speaking that I'm speaking for the Nash County Commissioners when they haven't authorized me to do that in any capacity.
Mr.
If they
Bellfield,
do, it'd be different.
Yeah.
But I just want you all to know that I don't do stuff like that. I'm smarter than that. I know I don't have all smarts, but I'm smart enough to go up there or anywhere saying that I'm speaking on behalf of the county commission unless they authorize me to do so. So I just want you all to know that.
I appreciate your comment, even though not necessary. I think anyone, I think there was only one person in the world that might have taken it that way. Quite frankly, I don't think anyone else did.
I tend to agree with you.
Of course, the reporter tried to pin me down and tried to get me to say something about it, and you saw my comment in yesterday's paper, very, very brief, and I only gave him that just so he would not put that nobody on the commissioner would respond to his answer, which he was going to do next, so. But no, we have never participated in their business on that matter, and as a board.
Yeah. Of course, the paper didn't quote me as a county commissioner.
They did not.
Yeah, but.
And I don't
it
think
was
anyone
said
listening
in
would have
paper.
taken it that way.
So some of them upset that the paper is not reporting the news correct. It was.
Well, you might not recall, but what you said, you have actually said, sitting there in a commissioners meeting, the same statement before.
Yeah.
Right.
I mean, you want to spend some money, city taxpayers' money that ought to be spent on some areas that's really needed.
Yes, sir.
And affordable housing, homeless shelter, all that's
Well, we
money
keep-
that they've already wasted.
If we keep talking, we're probably gonna dig a hole a little bit deeper, so I'm gonna move on. That's all right with you, sir. Anything else?
I just wanted to mention that I believe our next presentation's mid-month or November. And if you have any recommendations for an outside presentation, please share them with me or Ms. Schatzer. For the inside presentation, Mr. Chairman, I continue to hear from time to time people questioning what they get for their taxpayer dollars from Nash County. And I just think it would be good for us to do a little work to try to educate our citizens as to what that 67 cents on the 100 provides to the taxpayers of Nash County. There are many people that don't really understand what they get for that money. So maybe that's something we could put a presentation together and share it, and then kind of promote that information so people would be aware of where that money goes. Because as we all know, probably about 90% of it goes to public health, social services, education, things of that nature that the city of Rocky Mount does not provide.
90% of it goes to three categories.
That's exactly right. So I would appreciate if that would be something we could consider putting together. I just think it'd be good
That's an excellent
information.
idea.
And probably a good idea to share it with the papers and the other media outlets in the area.
Yes, sir.
Thanks.
You gonna put that on your list, man?
I have it on my list.
Okay.
I'm sorry, I didn't mean to add to your list.
That's okay.
At least
I
you got a
think it'll
couple
be an
more.
excellent presentation, good idea. I had two brief things. I noticed in something you sent out today, you were potentially looking at a meeting on an odd date of the board, 26th of October. Is that a confirmed thing so we can put it on our schedules?
Yes, so Susan Phelps
Yeah,
was sharing
no, it
that
was Susan, I'm sorry.
Ted Abernathy is ready to, well, not quite ready to, but will be, October the 26th is being proposed as a date that the board come together, and they'll also invite all the stakeholders that took part in Mr. Abernathy's survey of folks, and then, of course, the public would be invited to hear that report for the Nash County Economic Development Strategic Plan. So they're proposing sometime the afternoon of the 26th. We hoped that maybe you all could look at your calendars today and propose a time for that meeting so we could get that scheduled.
As long as it gets 2 o'clock on, I'm okay. I've got some kind of meeting with this school office at 11:30.
Okay.
But how does everybody look on that date?
Make it work.
What time you want it? 2:30, 3 o'clock? Do you know the length of the time, anybody?
I do not know. We just were given information that afternoon.
Okay. 2:30 suit everybody? Okay, let's do
Okay.
2:30 then.
Great.
And
What is that date again?
October the 26th. It's a Monday.
October the 26th.
And they do apologize because they know they've already scheduled something with the board on the 14th of October. So there will be 3 meetings in October.
Yeah, right,
You say 2:30.
2:30, yes, sir. I was going to ask Z, did anything get scheduled for that I asked for, the pre-meeting for the school, before the meeting? Have we moved on that anymore?
I've heard back from the superintendent's office, but I have not heard back from the clerk to the school board.
Okay.
So I'm just waiting to hear back.
Now, Janice, is that for the regular meeting or the
That's
pre-meeting?
That's the preliminary meeting.
Okay, the pre-meeting, okay.
Any date set on the normal meeting we have each year yet?
I'm still
They're
waiting.
working on that too?
Yes,
Okay. I know it's difficult to get that one scheduled, but
yes.
as soon as you can get something on it, I greatly appreciate it. Seeing nothing else, I'd entertain a motion for adjourn. I am adjourning, correct?
Yes, sir.
Okay, don't have anything else. this
Motion
month.
to adjourn.
Have a motion, is there a second? And a second by Mr. Belfield. Any questions on that motion? All in favor, let it be known by saying aye.
Aye.
Any opposed by a like sign? Stand adjourned. Thank y'all.